Hello, everyone. My name is Luis Perez, and I'm the President and CEO of Mental Health Connecticut. We're celebrating Mental Health Awareness Month this year, and with me today is Eric Galvin, President and CEO of Connecticut. Welcome, Eric.
Glad to be here and glad to see you after so many months that we have not been able to get together.
Likewise, as we were reminiscing, it's amazing that it's been a year since we had this same conversation. Well, hopefully not the same conversation. So much has changed in the past year, and would love to hear a little bit about what Connecticut has done during the past year to support both your members and your staff. But let me just start off by saying that we're so excited to be partnering with you again this year, and we're so grateful that you're celebrating your 40th and honoring Mental Health Connecticut with an incredible match. For those of you who do not know or have not heard, Connecticut has agreed to match our goal of $31,000 in 31 days. So that is an amazing gesture on your part. And tell me a little bit about what that means and how why it is that you support mental health here in Connecticut and elsewhere.
Of course. And first of all, we couldn't be happier to partner with you again this year. As you know, we really think about the whole person when it comes to healthcare, not just their maybe acute medical conditions, but we think about their wellness and their well-being. And mental health is such a big part of that, especially as we think about what this last year has challenged all of us, has challenged our neighborhoods, our society as a whole. And, as you mentioned, we're celebrating our 40th anniversary. We were started by a group of doctors in Hartford that just wanted to give a better healthcare experience to their customers. And those traditions continue on today. So we felt that this was one of the best ways that we could celebrate our 40th anniversary.
Great. And again, congratulations on your 40th. And it's evident that, something that both organizations share is that we both started from a consumer perspective and ensuring that people could get the best care, whether in primary specialty or behavioral health. This year's theme is hashtag 31 Tools to Thrive. And I know that giving back has been something that Connecticut has been very committed in terms of communities that you serve. Can you share a bit about Connecticut's history on this and how this came to be?
Well, if you think back to, and I mentioned how we were started by a group of doctors, for them it was personal at the time. And that's a theme that we continue today. When we think about the people that we serve, these are our friends, our family members, our neighbors. I have family members who are customers. And so when I think about how we want to go and give back to the communities that we live in and that we work in, it's personal. It's something that we continue to pull through. As a company, we provide about $1 million of support to various community organizations, roughly 150 of them. And, we really try to keep those donations in Connecticut because it is home. And it's and there's so much need right around the corner from each of us. So we really try to keep it local. Healthcare is local. Our colleagues are all here. Many of our family members are here, and it's really important that we really try to focus on local causes and service.
Yeah, and again, during the past year, that local and personal touch has been so important for so many people that we're feeling isolated, right? And
absolutely, and Luis, not to interrupt it.
No, please.
As we saw the food insecurity playing out in every newscast, that was one of our motivations to reach out to Food Share and Connecticut Food Bank. And then, we have had a long history with Habitat for Humanity. That has been a challenge during, these sort of COVID days, but we've continued to stay at it. even things like junior achievement, where, I used to love going into the classrooms and being able to teach one of the programs. And we've stuck with those programs, even though we've had to adapt and do it a little bit differently.
Yeah, and everybody has had to adapt, right, and shift the way that we conduct business. Here we are a year later after meeting in really in the thick of the beginning of the pandemic, or the height of the positivity rates. And, we also had to shift, and I would imagine that a lot of those wellness checks that you have instituted resulted, I understand, in thousands of calls for your customers. Did those pandemic shifts inform how you're thinking about the future of healthcare, and what? Tell me about what you're doing with that.
Without a doubt, the program that you're referring to, we called Peace of Mind, and it was really tens of thousands of outreaches to our customers, frankly, just asking them, how are you doing? What do you need? How can we help? And there was overwhelming positive support and reaction from our customers, because they weren't getting a lot of, maybe from friends and neighbors, but they weren't getting a lot of outreach from companies that they rely on for certain services like healthcare insurance. We actually ended up winning a somewhat prestigious award, what's called the Stevie Awards, and we won a gold award from the Stevie organization for that program. We're really proud of it, and that's just one of many pandemic shifts that we've seen happen. You think about, and especially in mental health, right? You think about telemedicine as a perfect example of where we had provided telemedicine and telehealth services for many years, but the take rate and the adoption rate was always a challenge. Getting people to use those services. Well, during the pandemic, those rates just skyrocketed, and we couldn't be happier about that. I'll tell you that the medical visits, they've leveled off a little bit, but the mental health visits have not. And again, couldn't be happier about it. I will tell you, the feedback from our own customer base is they want more of it. They want more of those capabilities. And we're going to be coming to market with even expanded digital capabilities for mental health, especially. So, the other big shift, and I don't necessarily have to tell you, you've lived it yourself, as many of the people have that are watching, that we've really had to readapt to the way that we work with one another as colleagues in this sort of distance working. And we always had the ability to, quote, work from home, but it became really a necessity, and then it really does have an impact on a company's culture. So we've had to find ways to keep the culture that we love and we cherish here at Connecticut, to try to keep that culture going and thriving. And we've had to do things, I'll do small group meetings, obviously all virtually, but little check-ins and just, how are you doing? What do you need? Very similar to what we do with our customers. So there's just some examples of how we've had to, really adapt to these pandemic shifts.
Yeah, absolutely. I think that has been a challenge for many industries, not just the care industries. And it's a challenge, right, to be able to maintain the camaraderie and the ability to have spontaneous conversations and brainstorming and just checking in with each other, right? In terms on the personal level, which is so important. If there is a silver lining from my perspective, is that the pandemic has forced the general population to think about their own mental health, right? It's no longer about who has a diagnosis. It's about how am I being affected as a human being, right? It's the condition of being human. You're going to be affected, not just physically, but mentally during these periods. And I think the other piece is that now with reentry and people, coming back to the workplace, there's a lot of reentry anxiety, and And I was wondering, what kinds of things are you doing at Connecticut to help your workforce both, get through the reentry level and then going forward?
Well, I would say first and foremost, we're not rushing to come back. We want to be smart about and take extra precaution when we think about who should be back in the office, and what does full-time in the office look like? Is there, very much like many of our children are in hybrid learning modes, do we also need to have some type of a hybrid work mode? And so we're working through those protocols and those rules, but as I said, there's no rush to come back. And, we want people to go and get vaccinated. We think that it's important that they take that step to protect themselves and their family members. But we want to be careful that we're not heavy-handed about that as an employer, because, there may be reasons that I don't understand that someone does not want to go and do that. At the same time, we can't forget that all of us are really dealing with what is a social justice revolution, and many of our employees are directly impacted, and we're all impacted in one way or another. And so we want to take all of those items and make sure that we're balancing them and trying not to push on any one lever too hard. Our team members are so dedicated. They have been doing a fantastic job virtually. As I sit in the office here today, there's probably about 60 people out of 750 that are here in the building, which is more than usual. But again, we're all spread out through the building and taking all of those precautions. Finally, I would say it is really about encouraging and giving people the time and the space for self-care. Being kind to yourself. And yes, we all work in, pressurized situations, but it's making sure that you have time to do something as fundamental as get up and move around, take a walk around the parking lot. I have some of my walking buddies that I walk not directly with, but we'll be out there at the same times. And it's just making sure that we give people space to do those kinds of things and encourage that through a steady stream of communication about, opportunities they can take advantage of.
Absolutely. Self-care is such an important piece of holistic wellness, right? And it really has to start there. Eric, I could talk to you all day long.
Likewise.
This is terrific. But it sounds like you guys are, as always, are the leaders in the industry, both externally and internally, and kudos to you for that. It's great to have our partnership, and again, I thank you for your time today. And I want to remind everyone that 31 Days of Wellness is not over. We're halfway through the month, so please check our website. Until hopefully not next year, Eric. I hope sometime soon we'll get to see each other and perhaps socially distance walk.
Absolutely. I'd look forward to that, Luis, and best to you and your entire team. We're just thrilled to be such great partners.
Great. Thank you. And thank you everyone for joining us. Be well.